How do thyroglobulin antibodies affect thyroid cancer monitoring? Imagine trying to track a hidden signal that tells you if thyroid cancer has come back after treatment. That signal is often measured by checking levels of thyroglobulin in the blood. But sometimes, the immune system produces thyroglobulin antibodies, or TGAB, which can interfere with this process. These antibodies are like little guards that attack thyroglobulin, which is a protein made only by normal thyroid tissue and differentiated thyroid cancer cells. After a person has their thyroid removed and has had radioactive iodine treatment, the thyroglobulin levels should be very low or even indetectable. If levels start to rise, it might mean the cancer is returning or still present. However, if a person has thyroglobulin antibodies, these can bind to the thyroglobulin in the blood and cause the tests to read falsely low or even show no detectable thyroglobulin at all. This makes it tricky for doctors to tell if the cancer is coming back because the test results might be misleading. About 1 in 4 patients with thyroid cancer can have these antibodies, especially if they also have autoimmune thyroid diseases like Hashimoto's thyroiditis. That's why doctors measure both thyroglobulin and thyroglobulin antibodies at the same time during follow-up visits. When thyroglobulin antibodies are present, they can cause false negative results, meaning the test might say everything looks fine even if there is residual or recurrent cancer. But doctors can also look at the levels of these antibodies themselves. If the antibodies decrease over time after treatment, that's usually a good sign. Conversely, if the antibody levels stay high or go up, it could suggest that some thyroid tissue or cancer remains. So, in these cases, the trend of antibody levels becomes an indirect marker of disease activity. Some newer testing methods are being developed to try to measure thyroglobulin without interference from these antibodies, like advanced laboratory techniques. But these are not yet standard practice everywhere. Because of this, the best way to monitor patients with thyroglobulin antibodies is to use both thyroglobulin and antibody levels together, along with imaging scans, to get a complete picture of their health. In summary, thyroglobulin antibodies can complicate thyroid cancer monitoring by causing false negative thyroglobulin tests. Doctors need to measure and interpret both thyroglobulin and thyroglobulin antibody levels carefully over time. This combined approach helps ensure that any recurrence or persistence of cancer is detected early and accurately. Always remember, individual cases vary, so it's essential to work closely with healthcare professionals for personalized follow-up plans.